Hi, Mary Felling, physical therapist here. And if you're someone who's been dealing with knee pain and find that even just bending your knee or trying to get down into a crouched position increases that knee pain, this video is for you. So all you're going to need today is an exercise strap. You can use a belt from an old rope, but you will also need a pillow. So let's get started. I'm going to have you on your back, and I'm just going to pull this mat up under me because we're going to be sliding our feet. All right, so in this first one, you're going to be using your pillow. You fold it in half, put it between your knees. If you've got a yoga block, you can certainly use that too. And this is what this first exercise looks like. We're going to squeeze the pillow, straighten your knees all the way till they're completely straight. Come back up, really squeezing the pillow. Short break, and we go into the next one. We're going to do 3 sets of 10. You ready? Here we go. Squeeze and extend your legs. Come back up. You're still squeezing, and you take a short break. All the way to fully extended knee. Come back up. Short break. If you have a sore back, if you've been dealing with back pain, you can do a little pelvic tilt. That'll help relieve that. Here's number 4. Looking good out there. I'm squeezing my legs together the entire time. Here's number 6. It's really important to get these quads back into shape to help the knee to recover from pain and dysfunction. Number 8. In particular, this exercise is getting the very inside quad muscle. It's called the vastus medialis oblique. That's 9. And here's number 10. All right, 2 breaths. Second set, squeeze that pillow. You give it all you've got. We're going to be doing 3 sets of 10, by the way. And as you go through these, if you start getting tired, fatigue, and you're shaking, that's a sign to stop. You can always add 1 more repetition on every day or so until you get up to 3 full sets of 10. Everybody's different, so you're going to be starting somewhere different than your friend or cohorts. Everybody's still doing great. This is number 6 of our second set. And all you're really thinking about is tightening the thighs and holding them together when they're being straightened and while they're coming back. Here's number 8. 9. Last one of the second set. Number 10, 2 deep breaths. And here we go again. First one of the last set. Again, if you're already feeling it and you're shaking, that's all you can do. Just stop for today. That's where you're starting out. Everybody starts out somewhere. When this muscle gets fatigued, this vastus medialis oblique, it stops doing its job to hold the kneecap where it's supposed to. And now, as it's weaker, the kneecap now has lost some of the stability it gets from the VMO when we're bending down, standing up. And that's just our Western civilization. Nothing you've done. It's just as we age, that's what happens. So we got to get that strength back to help that knee feel better. Very good. Okay. Next one, you're going to be on your tummy. If you are somebody who deals with back pain, you want to use the pillow under your stomach, under your hips. Really, it just kind of takes the strain out of the low back when you're on your tummy. All right. So in this position, I'm going to have you bring your bent knee on the side that you're working on. So here I've got my right leg bent because it's my right knee that's kind of problematic. So we're going to work the glutes on the same side that you're having problems with your knee. And you're going to lift up like that, hold a few seconds, and come down. We're doing 3 sets. Here we go. If this still bothers your back, do a little bit of a pelvic tilt. That will help to keep strain out of your back while you're doing this. And there's no strain on the knee here. That's a nice part. Bridges and those kinds of glute work things would probably put a little bit of a strain on the knee. And we've got 2 more. Here's number 9. And number 10. Very nice. Take a short break. 2 deep breaths. And back again. Here we go. If you notice, my ankle and my knee are both about a 90-degree bend. So I'm not pointing my toe up like that. I'm kind of pushing my heel towards the ceiling. Here's number 5. And if you're starting to fatigue and you're shaking, you just stop here and every day or 2 add another one on until you can do a full 3 sets of 10. And a short break, we do 2 deep breaths. And here we go, last set. Squeeze the tush, squeeze that cheek at the very top, squeeze it while you're raising it, and really squeeze it hard when you reach the top. Keep that knee close to the other knee, so you're not going out here, keep it close. There's number 7, 3 more. And last one, squeeze hard, good, and come down. If you are someone who has pain in both knees, then you go ahead, rerun this exercise and do it on the other leg. All right, we're going into stretches, so you're going to lie on your back again. If you have back pain, the best way to get onto your back is roll from your side to your back like a log. You're going to grab your strap. This is where those yoga straps, or exercise straps or belt come in. If you're using a belt from a rope, wrap it around twice like this. That'll give you a better hold. I have loops in my exercise straps. I'm just going to put my foot in there and cross it. All right, we're doing a stretch on the IT band. The outside here runs all the way down below the knee. So you're going to get up about your heels 2 or 3 feet up off of the floor. And it's going to be pulled across, and we're going to hold 30 seconds. So for all of you, it might be a little different. You just find the spot where as you pull across, you get any kind of a pull through the side of your leg, back in your hip, or on the side of your knee. So go ahead and start that clock. So some of you are going to be lower like this, have your foot low to the floor. Some of you are going to be much higher to be able to feel that stretch. So you got to kind of play around with it. The leg is completely relaxed while you're in this position. The arms of the strap are holding your leg over. If someone came by and just pulled the strap out of my hands, my leg would fall down because it's not doing any work. All right, let's take a short break. And up again. Here we go. Bring that leg across to where you feel the stretch. And really check and make sure your leg's relaxed. We've got that timer going. If you've been doing this for 7 or 8 days and you're not feeling some of the loosening and relaxing, you might need to hold it 3 to 5 minutes. That's what science says needs a 3 to 5 minute hold for the fascia to start opening up. And everybody's different. I need 6 or 7 minutes. My daughter needs 7 minutes for the fascia to start softening. But 3 to 5 minutes is where you start. All right, last one, coming across your body. And you notice I'm not going like this. I don't have my hip coming around. My butt stays back on the ground and just the leg comes across the body. That way we could really make sure the IT band is getting a stretch. IT bands get very tight in our Western society. And as they are tight, they pull the kneecap towards the outside, and now the knee is not in its natural alignment, so all kinds of dysfunction and pain and inflammation set up. So we're getting one of the major contributors to knee pain when we do this. All right, and the last one, we're going to do a stretch on the hamstrings. It's the muscle behind the leg. It goes all the way from your sit bone down to behind the knee. So in this one, your knee is straight and then just a little unlocked. So I'm not having a full extension on the knee. That's not good for the knee. We know that when we do a hamstring stretch, just a little unlocked. Pull it up till you feel a stretch anywhere along here. For me, I feel it in the back of the knee and nothing up here. So that's where I'm starting. I'm not going to go past that. All right, we got that clock started. And we're holding 30 seconds. And you should feel this. If you're not feeling it, bring your leg up more, or make sure you're pretty straight in the knee. You can't be like that. You can't be all the way super tight. That's not really good for the knee. Just a little unlocked. And the longer I'm here, I feel it go down in my calf and higher up behind my thigh. That's fine. Short break. These are muscle stretches. Again, if it's been 6 or 7 days, there goes that clock again. And you're not really feeling any different in the back of your leg, or you don't feel like it's being stretched, then you probably have to hold it that 3 to 5 minutes to get the fascia component. So what we're doing in these 4 exercises is we're addressing all the major problems that are common and underlying factors to knee pain and prolonged knee pain when you're crouching and bending. That was 2. Here's our last one. Ready? And I can feel I can go just a little bit higher now, just a little bit. So I've got some slack coming into the muscle of my hamstring, which means I can bring my leg up higher. So getting that opened up. Yay! If your back hurts, do a little bit of a pelvic tilt. If you have any kind of a back issue, that'll help protect it. All right, very good. All right, continue this for 14 days in a row. And then maybe twice a week, after that, to maintain those improvements. Thank you for watching with me today, and I'll see you in the next video.